Loiasis, African eyeworm. You feel something move across your eye. Not like dust, but like it's wiggling and crawling around in there. Then your eye starts itching, then burning. Well, unfortunately, you might have loiasis, also known as African eyeworm, caused by a parasitic worm transmitted by deer flies in Central and West Africa. A bite introduces microscopic larvae into your bloodstream, where they can grow up to 7 centimeters long. As they move through your body and across your eyeball, you may experience sensations like itching or a crawling feeling. While it starts with mild symptoms such as a tickle or blurred vision, it can lead to swelling and soft bumps, known as calabar swellings, on your arms or face. These bumps are your body's response to the worm living in your eye. Leptospirosis. You wake up one morning and your entire skin is bright yellow. Your eyes, tongue, and literally everywhere on your body looks like an overripe lemon. You also feel like you've been beaten black and blue by a very angry gorilla because every single joint and bone hurts. When you finally made it to the hospital, the doctor broke the news. You had leptospirosis. This bacterial infection can sneak up on you while enjoying outdoor activities like swimming or hiking, especially if you come in contact with water or soil contaminated by an infected animal's urine. Dogs are often the carriers. Initially, it mimics flu symptoms like fever and chills, but can escalate to severe organ complications, including liver damage and kidney failure. Unfortunately, many people mistake it for a cold. So, by the time you realize it's not, your liver is already filing HR complaints. Fatal familial insomnia. You ever been so tired you feel like you're going to die? Well, fatal familial insomnia is a rare genetic disorder that causes your brain to completely forget how to sleep. It begins subtly with sleep difficulties and anxiety, but quickly escalates to severe issues like hallucinations, panic attacks, muscle twitches, and total insomnia. This condition results from a mutation in the PRNP gene, leading to a misfolded protein that disrupts the brain's sleep control center. There's no cure or treatment, and once symptoms appear, most people survive only a few months to a year. Sleep medications are ineffective since the brain can no longer power down. Paraneoplastic pemphigus, PNP. First, you'll start to notice really red-hot blisters in your mouth. We are talking ulcers, raw, angry sores that make chewing feel like you're trying to eat a cactus. It then spreads to the skin and serves as a warning sign of an underlying tumor. The body mistakenly sends antibodies to attack the skin and mucous membranes instead of the tumor. Diagnosing PNP involves thorough testing, as doctors must identify the tumor causing the autoimmune reaction. Treatment requires addressing both the tumor and the autoimmune response, often using steroids, immunosuppressants, or chemotherapy. While rare and aggressive, early detection of PNP can be crucial for survival. Cold agglutinin disease. That's a condition where exposure to cold temperatures causes your immune system to mistakenly attack your own red blood cells. When you get cold, antibodies called cold agglutinins activate and perceive your red blood cells as intruders, leading them to clump together. This clumping can block blood flow and break the cells apart, resulting in symptoms like fatigue, dizziness, and changes in skin color, leading to shades of blue and purple. Many people may not realize they have this condition until they experience numbness in their hands or other symptoms during colder weather. It can be triggered by infections or appear without a clear cause. Treatment often focuses on keeping warm and calming the immune response to prevent further complications. Progeria. Hutchinson-Gilford progeria syndrome, HGPS, is an extremely rare genetic condition that causes children to age at an accelerated rate. By the age of 2, a child with progeria may exhibit symptoms typically associated with elderly individuals, such as hair loss, stiff joints, fragile bones, and cardiovascular issues. Sadly, most affected children only live into their early teens or 20s. The condition results from a mutation in the LMNA gene, which encodes a protein called lamina A. This protein is crucial for maintaining the structural integrity of the cell nucleus. In progeria, the mutation produces a toxic version called progerin, which deforms the nucleus, causing premature cellular aging. While the condition sounds alarming, it is incredibly rare, affecting about 1 in 20 million births, with roughly 100 children worldwide at any given time. Interestingly, healthy individuals produce small amounts of progerin as they age, but it's at levels that do not cause the dramatic effects seen in children with progeria. Fibrodysplasia ossificans progressiva, or FOP. That's a rare condition where the body misfires during healing. Instead of repairing injuries with scar tissue, it builds bone everywhere. A gene called ACVR1, which normally regulates bone growth, goes haywire and triggers bone formation in response to minor injuries, infections, or even routine shots. Once this process starts, it cannot be reversed. People with FOP face risks even with basic medical care. A simple flu shot or a fall can lead to permanent bone growth. This condition can lead to stiff joints, fused limbs, and severe limitations in movement, making everyday activities like walking and breathing difficult. Methemoglobinemia. Have you ever felt dizzy, a little out of breath, maybe even a weird shade of blue? And you think it's just tiredness? That's methemoglobinemia condition where your blood can't effectively carry oxygen. Instead of functioning properly, hemoglobin mutates into methemoglobin, which doesn't deliver oxygen to your organs, leaving you feeling dizzy, short of breath, or even bluish. This condition can be genetic or caused by certain medications, chemicals, or topical anesthetics, like the numbing spray at the dentist. Thankfully, there's an antidote called methylene blue that reboots your hemoglobin, restoring its ability to transport oxygen.
Thanks for watching. I hope you like it. Next video will be coming soon. Bye!